As cases of a deadly fungal infection spread across the nation, hospitals here in San Diego say that's not the case locally. Still, they remain on high alert.
Our Sarah Alegre live for us outside Rady Children's Hospital this evening with what you need to know about it. Sarah.
Andrew, Maria, today at Rady Children's Hospital, they wanted to get a message out, trying to quell some fears regarding the spread of that deadly infection, otherwise known as Candida Auris. Now, they say, while it's not currently an issue here at home, it's only a matter of time before it makes its way to San Diego.
People in San Diego who are reasonably healthy, you don't have to worry about this.
A warning coupled with reassurance to the community amid high tension nationwide following the ever-growing spread of a deadly fungus, Candida Auris, also known as C. auris.
It's a word of caution to all the hospitals in the United States that this particular Candida strain is spreading.
The big question, what is it and who does it target? According to Dr. John Bradley, medical director of infectious diseases with Rady's, it's a form of a yeast infection or a so-called superbug, characterized by its resistance to medications. Those infected commonly show these symptoms.
Either a red sore patch in your mouth or in your intestines, which you can't see, or if it invades fever, and that's the most common. If the Candida should settle in one of your organs like the lung, then you'll start to cough and you could get a smoldering, increasingly serious pneumonia.
The fungus is mainly a concern with those who are immunocompromised patients, stemming from children to seniors. The concern at Rady's lies within their cancer patients.
If you're an immune-compromised host, once it enters, it can really cause an infection. So for healthy people, the regular Candida albicans that causes thrush is not a real concern, and Candida auris for regular people who aren't immune compromised is not an issue.
The CDC is calling the fungus a, quote, urgent threat while noting its resistance to medications. But according to Dr. Bradley, it's both preventable and treatable.
But I want to reassure everyone that this isn't a situation where we have nothing. We have more powerful agents, but they're ones that we usually hold in reserve and don't start out with treatment.
Now, in the state of California, there have been over 350 cases reported so far. There have been none yet here in San Diego. So if this were to occur, the spread would most likely happen in our local hospitals. That's why the team at Rady says they're working hard to prevent the matter, mainly through early detection and testing. For now, that's the very latest outside of Rady Children's Hospital. Sarah Alegre, Fox 5 News.